from the Association of American Publishers for his book titled Nanoelectronics Mixed Signal System Design, published by McGraw-Hill in 2015. He has been recognized as an IEEE Distinguished Lecturer by the Consumer Electronics Society. So he is an inventor of 4 US patents, and he is the author of 250 peer-reviewed articles and 3 books. So, good evening, sir. Hello.
Good evening, sir. I extend my heartfelt obligation to you for sparing your valuable time in a very quick period of time to prepare the valuable talk. So, I request, sir, please continue with the presentation.
Okay. Good evening, everybody. This is a presentation about smart healthcare, and a little bit background that I like to give. I've been doing research on smart cities with specific emphasis on smart healthcare for last several years. And when I was invited from CET to give a talk, I thought, okay, this is a very interesting presentation, which you will have some pointers to initiate research in this area. So I consider smart healthcare followed by smart agriculture are 2 important areas. Okay, so as even smart energy. Okay, and if you remember 15th August presentation by Prime Minister of India, Narendra Modi. So if you see, he was emphasizing quite a bit on smart healthcare, and India is going to start the digital health program and so on, where all health records will be electronic. All these, which what we call here as EHR, electronic health record, which US has already done, and we have a very good system in place. And I was glad to hear that India is trying to put a similar thing. So just to give a little background about me, I graduated actually from CET in electrical engineering in 91-95, and then went to IIS Bangalore. I did a master's in those days. It used to be called system automation. Now what is called actually artificial intelligence. So artificial intelligence basically was an area which got a lot of theoretical and other things, research and other development long time ago. Okay, and in fact, my master's that area. But now AI is getting a lot of importance because of primarily the reason is the hardware which need to run the AI. Okay, that is available now, particularly graphics processing units and then FPGAs, very high-end FPGAs are there, and in addition, actually, there are custom-made AI hardware like a tensor processing unit by Google and so on. Okay, anyway, so then I did my PhD in low-power hardware design from Tampa, and after that, I joined here in Texas, and I've been here for 16 years, and smart healthcare and broad umbrella of smart city is my last several years of research. And again, it's very interesting to learn Bhubaneswar, the city in eastern part of India, is trying to build some components for smart cities, and I'll be glad to help if any direction, any help needed in that area. Okay, so feel free to interrupt me if you have any questions anytime, or we can take up questions in the last part of the presentation. Okay, so you can note the slides or something where you have questions, and we can visit those questions after the end of the talk. Okay, so smart healthcare. That's the topic of today's discussion. And I have a lot of materials. I shared the slides with you, and I assume all of you downloaded so that with low bandwidth connection also you can see those slides, and time to time I'll tell you what slide number I am so that you can sync. Okay, so we'll have some discussion how smart healthcare actually evolved, and what are the characteristics healthcare systems should have to call it a smart healthcare. What are the components that builds smart healthcare, and some examples. Essentially, some research that my students have done. I have graduated multiple PhDs in this area, and several PhD students are working on this area right now with me. So I'll give you some examples, and then what challenges we typically face, and what possible solutions can be tried in those all directions, conclusion, future direction. Healthcare to smart healthcare, few slides just to give you the idea. So health is essentially a state of human body with different conditions that it has because of a complex subsystem, complex system with heterogeneous subsystems. Okay, like human body, we can say as a nano electromechanical system with biology and so on included. It's very difficult, right, to model life actually. So, but in general, we have a lot of small things and making bigger things which are electrical in nature, mechanical in nature, a lot of chemicals, and as well as the biology, how to define that using this subsystem is a challenge, of course, but that is our human body. So it's a state of the system that human body has is essentially the health. And in a traditional healthcare system, it's essentially problem of the patient. Patient, imagine, is having some certain situations. As a result, he needs to visit various entities to get a pure, rather a solid healthcare. For example, he needs to talk to his or her specialist, primary healthcare provider, then health insurance, pharmacy, all this. So one single person needs to deal with so many, you can call them as stakeholders or entities which are part of the healthcare system, okay, which is a lot of work, and the patient doesn't get a personalized healthcare. That is the traditional healthcare system. And if you know, like in the traditional healthcare system, patient is essentially holding his own healthcare record while visiting different hospitals or doctors and so on. So that's the challenge, okay, and particularly no personalized healthcare and not much communication among the stakeholders, and the patient is dealing with so many variety of entities, okay. And then telemedicine is one example how little bit help was provided to the patient, where patient from the remote areas can be helped with the help of communication system and so on. So where that means a patient doesn't have direct face-to-face access to the doctor, but still get certain help with a diagnosis using audiovisual, then telecommunication or the mechanism. So this is the origin of telemedicine. And after that, electronic health came, where essentially all the physical, let's say, paper-based health record and so on is made electronic, and that's what I was mentioning. That is, India wants to do this. That is, all the electronic health, all the health record of people, India wants to make electronic. So this is what exactly it is. And this basically has been done here in US around, I would say, 20 years already, and it's reasonably doing well. Now, my experience tells we do not hand carry anything. That means patient doesn't hand carry any health record, and health record is available to all doctors, like a primary healthcare provider, specialist, pharmaceutical, all these entities. In those who are in the network, same network. Okay, so as a result, okay, like a patient doesn't carry any record to anywhere. So as prescription even goes to the pharmacy directly, we just go and pick up. So that's the advantage electronic health record. So we telemedicine and e-health essentially has come like that. Then is the connected health. Connected health is amazingly helpful, and how it is because the stakeholders are connected. Okay, hospital, supplier, patient, then labs, and so on. All these are connected. As a result, like they can make better decisions. For example, when we visit a primary care practitioner, we do not have to go with all the health record when visiting a specialist or visiting a lab and so on, and a lab person can send all the lab reports to the doctor or to the PCP directly. So all these are as a result of connectivity. Okay, connected health then came. And after that is the mobile health. Okay, so mobile phone now we have in our hand. It's not just a phone. It is basically a full-blown computer. Rather, it's beyond a computer, because computers do not have rather so many sensors that a mobile phone has. Okay, a mobile phone has much more variety of sensors. Whether you take accelerometer or sensors to do a lot of health like heart rate and so on. And in fact, it has a reasonable software capability to keep the record. Okay, I do myself variety of health record in my mobile, and in fact, right now EKG and other things, blood pressure is rather very straightforward. Rather EKG and other things we are able to keep in the mobile phone and able to take. So this is definitely a significant thing called mobile health, and then that encompasses everything that we just discussed. That is, whether you talk about telemedicine or mobile health or connected health or electronic health, everything is encompasses in a bigger umbrella that we can call as a smart health. And what it is, will this is all about this talk. And in the center, if you see, I have something called Internet of Medical Things. Okay, so Internet of Things, IoT, you might have heard, but a specific example of IoT is the Internet of Medical Things, where we can say that different biosensor that goes to the body and the connectivity that you saw in the connected health, then electronic health record, then different other like wearable and implantable, all these together constitute a bigger umbrella that we can call as a smart health. Okay, so as a result, if you comprehend, that is, this smart health is essentially with the patient all the time, everywhere. It's a part of the person, and because of the sensors, and then the sensors are connected. Okay, particularly, let us say in a simple example, when we have fitness tracker like a Fitbit and so on, okay, that's all connected. I always wear, okay, because I want to monitor, okay, and that fitness tracker is continuously connecting to my mobile phone and so on. So as a result, there is data that is going, and certain decisions like heart rate and so on can be taken based on that data. So this is the big picture of smart healthcare. So what characteristics healthcare system should have to call as smart healthcare? Okay, so first of all, examples or beginning of smart healthcare, we can say, is starts basically from the wearable medical devices. Okay, fitness tracker is an example. Okay, then headband, insulin pump. Okay, then skin patches and seizure detection watch. All these are certain wearables, and what estimation shows globally, at least in the range of 500 million people actually wear some kind of wearable for medical purposes. Okay, so that's a lot of people, and which is very interesting, because then people are essentially health conscious and taking care of their own health. Then other type of device that we are aware, that is called implantable medical device, and left side figure shows a specific example where it's a pill that is like a capsule with a camera, and that pill or that capsule essentially can go to the body. Somebody just takes like as we take regular capsules with a glass of water, and then that built-in camera and the connectivity essentially does the rest of the job. It goes inside to the body, that is to the intestine and so on, and it keeps on taking pictures. Okay, a lot of pictures. So as a result, a doctor can get the information of internal details of the patient without really doing a lot more other mechanisms. Rather, it's very clear. Okay, that is as if somebody has gone inside the intestine to get the pictures and so on. So this is extraordinary thing that is that has happened. And then other examples are brain pacemaker, for example. There is a device that can be implanted to treat a lot of conditions in the brain, and then also in general implantable in the form of MEMS device, that is micro electromechanical system and so on. They are coming, and they can be eventually used to deliver drugs to different parts of the body, and then cure basically health conditions there. So in general, if you see smart healthcare, we are using day to day, okay, without a knowledge, with a knowledge for healthy living, okay, and then home care is being done, and particularly it has a lot of potential for assisted living, that is the elderly community who need some sort of health attention all the time. Then also it is going in the direction where it can handle acute care, okay, where like community hospitals and nursing home and so on, it can deal with some serious health situations. So particularly I see the chances of implantable devices and so on. So this, in general, healthcare is a big market, and it is obvious because of we are all aware of the pandemic situation and so on. So this has potential, and this will further grow because of the situations that we face now. So in general, if we want to define what is smart healthcare, it's the conventional healthcare with the body sensors, with the technologies, and particularly different data-driven, okay, AI and machine learning. So these are the things together, and then we can say electronic health record is part of the information technology and so on, or you can have separate. So it doesn't matter, but as a result, the conventional with these additional features making smart healthcare possible. And we use the term, now you are our Internet of Medical Things from this few slide, what it is. And a bigger scale, we can call this as a healthcare cyber physical system, and to integrate various data and then health care mechanism and so on. If we want to visualize how a healthcare cyber physical system will look like, this is a layered approach, 4-layer architecture, where in first layer, different body sensors, then the network that connect those body sensors, like body area network, it can have connectivity of implantable, wearable, and so on. And then layer 2 is user interface, where user is getting access to the information that sensors are provided. And then layer 3 is essentially AI machine learning model, where different models run on the data to predict some things, so that certain healthcare decisions can be taken. Okay, and this black box information in layer 3 is very interesting. That is not just individual data. Based on the data, somebody is predicting somebody had a bad heart condition or a stress condition, or somebody needs to eat differently because of bad diet and so on. It's not just individual, which is very important. Personalized is one important aspect. But in addition, what is a bigger picture, that is, if we have data of a bigger entity, like a whole city, whole state, like that, then we can take better decisions. And the current pandemic situation itself is an example that tells how data is important to make decisions, okay, and so on. Okay, and then as a result of all these data then come from the sensor and so on, okay, various stakeholders, whether it is emergency provider or doctor, they have access to all those, and they can take certain decisions as a result. So the person being a part of a bigger entity still gets personalized healthcare. That's the big aspect. So this is a healthcare cyber physical system. And healthcare cyber physical system, if we do a one-to-one correspondence between patient and healthcare provider, okay, so patient is important, and patient is getting personalized care, no doubt. But if doctor can have basically hundreds of patients to deal with, okay, so so that even in that situation, personalized care coming to the patient is a key thing that smart healthcare is providing, okay. And patient essentially different past health record or current health vitals and so on. Okay, all these are basically going to the internet, and Then as a result, certain decisions with machine learning model can be taken. And then as a result of different patients of a CT and so on sending similar information, doctor can predict certain conditions. For example, let us say this season there will be a lot of flu, or that season there will be a lot of allergy condition and so on. Doctor can make assessments based on all the data and then intervene if situation demands. Okay, so this is a simplistic view of how healthcare cyber physical system can help. So 7 different features a smart healthcare system essentially has, and in the middle what I have is what I call as personalized. That means the previous slide I showed, that is a doctor may have hundreds of patients, but each patient can get personalized care. That's the beauty of smart healthcare. In addition, persuasive, preventive, programmable, all these are different characteristics that smart healthcare has. Perpetual, the reason being, it's there with the patient all the time, 24/7. Okay, so that's the perpetual. Then participatory, the patient is participating in the healthcare basically system. Okay, it's providing data and also can take certain automated decisions, and so as a result, it's the patient is participating. Then predictive. Okay, so you can make certain predictions based on the current data and the data of the others. Okay, what health condition may have or what condition will be having after a certain time and so on. So these are 7 P's of smart healthcare. Okay, and if we see like smart healthcare, okay, we can divide the task into clinical aspects and daily aspects. Okay, which smart healthcare is able to do with daily healthcare. We're able to do daily diagnosis with wearables, at least fitness and emotional analysis and so on. Then daily therapy is being made possible. At the same time, clinically, okay, like different diagnosis, then treatment evaluation, and all these things is being made possible by smart healthcare. So different advantages and limitations smart healthcare has. Okay, the advantage definitely real-time intervention, optimal utilization of the resource. That means one doctor can deal with more number of patients while providing personalized. Then hospital can deal with more number of patients and so on. Then even if somebody physically cannot come to the hospital, can still get quality healthcare. So that's the capability that smart healthcare has, and because of these capabilities and the way smart healthcare system is built as an internet of medical things or as a healthcare cyber physical system, it comes with certain challenges. Okay, what are the challenges? Obviously, because the sensors and so on are connected continuously to the internet. Security is a big problem, privacy is a big problem. And in US healthcare system, privacy is a serious issue. That is even in a family, not everybody has access to each other's healthcare records because of the different laws in place, and that's a privacy, security, all these are bigger challenges. And at the same time, more things are there. For example, how to handle large volume of patients, and then market challenges, so that is physician compliance, and then data overload and so on, non-healthcare facility. All these are challenges that we need to face and need to solve, and a lot of research is ongoing to solve these, of course. So we saw with these past 20 slides or so, like how smart healthcare evolved from the healthcare and what characteristics smart healthcare system has. And now we'll go to a little bit discussion of what components, okay, make a smart healthcare possible. You might have been already aware with the slides that you saw, but a little bit we'll see what are the components. Okay, first, the big picture point of view, this is how we can define basically Internet of Medical Things based healthcare cyber physical system, or CPS. So if you see very simplistic diagram I have drawn to make us aware. Okay, so we have wearables with myriad of sensors, and that sensors for not just from one person in a bigger system, millions, billions of persons, that data is coming continuously, and online data, okay, for various situations there. And then with different remote stations, doctor is accessing, okay, the data. And then when a patient visits, the patient can have different ID mechanism and so on, and as a result can have more easy, what you can say, data that goes into the system, as well as gets personalized healthcare. And in addition, overall, whatever we have, that stays in the cloud, no doubt, and billions of people can be part of such kind of network. And as a result, in the healthcare can have data of billions. And imagine, suppose India goes, and India is going, okay, with the EHR system, electronic health record system, then it will have more than billion population in the EHR, which is a lot of work for the computer science and engineering personnel, okay, and IT personnel to have. So anyway, so this essentially will be followed, okay, in a healthcare system that is Internet of Medical Things based or cyber physical system based, okay, to provide smart healthcare. So it's a we can see it's a collection of medical sensors, okay, healthcare database, and so on, that makes smart healthcare possible. So the basic ingredient is the sensor that I was mentioning, the way Internet of Things, okay, sensors and their connectivity. Similarly, Internet of Medical Things are biosensors and sensors that is specific to the healthcare, those things, and then their connectivity will see later. So, and sensors are key. Without sensor, we do not have a smart healthcare. And a variety of sensors are there, okay, for a variety of health conditions. For example, EEG, ECG, okay, then glucose monitoring is a serious problem in India, particularly a lot of people are diabetic, and those are different types of sensors, okay, and then all those variety of sensors that goes to brain related, heart related, and blood, and so on, okay. So all these are important for the smart healthcare. So smart healthcare starts from sensors essentially. And then their connectivity is very important, and this connectivity is very key. That is, human body, okay, will not accept any type of communication. For example, suppose we want to have signal coming through our bone, or through our muscle, or through our body, okay. So communication has to be different type. So not all connection can go through the body. So it seems Bluetooth can go and Wi-Fi can go through the body and give us signals, okay. But there is a need for, and which is being done. The last row I have the medical implantable communication service, okay, with a specific frequency band and data rate and range, and obviously it has to be way low power, okay. It can provide better connection through the human body, and that is what is important. So after sensor, communication is key for a smart healthcare system. So this is an example. What does a electronic health record look like? Data is key, and this record stays for individual patient as well as for millions of patients in a city or billions of patients in a country. Okay, so this has some sort of standards, so that every stakeholder, like starting from doctor to insurance company to lab, and everybody has understanding, and they contribute to different parts of the record. For example, suppose a doctor sends the patients for let's say X-ray, or for other like ultrasound and so on, for diagnosis of different health conditions. Then lab people take care of that, and then they contribute to the health record. So as PCP and contribute something health record to this, and so on. So this is a health record, I mean EHR, that different stakeholders have access and add things for a specific patients. So once you have that health record in our hand, okay, and then we can do different analytics, okay. Specifically, machine learning models can develop based on the electronic health record, how it can help potentially. For example, let us say we have healthcare record. From there, we analyze that this year how many allergies and what kind of allergies are coming, and next year we are ready with some medication for that. Similarly, let us say we know that this season this kind of health happening in a specific city or a state and so on, then the healthcare system can be ready with medication, with vaccine and so on, as a result of having very good data. So a system analytics, that is the data that we have, those we are taking, those analytics we are doing for our day-to-day care, as well as we are doing machine learning and then analytics to have our annual healthcare and so on, which I see that every time. For example, let's say every September to November, in that time we have flu season every year. That means kind of cold is coming, flu vaccine has to be taken, and how many flu vaccine will be there, and what kind of flu vaccine, all these basically done based on the health record and so on available. So I see that how it is effective. Okay, and so that means machine learning model is helping, okay, to decide those, and so that is a serious component of smart healthcare. So you might be aware, okay, that is artificial intelligence, machine learning, and deep learning, all these terminologies. So artificial intelligence, as I was mentioning at the beginning, that is existed even 50, 60 years ago, as you can see. Okay, and that's nothing new. Okay, machine learning also existed from 80s. Okay, and so all these existed. This is necessary to develop different models based on the data available. Okay, so now last 10 years or so, deep learning which is a subset of all these things, is getting very popular. The reason being, now the models can run with the hardware that we have, which did not exist in the past. Like, for example, high performance GPUs and high performance FPGAs and so on. And in fact, custom hardware accelerator for AI also getting a lot of attention because of the specifically people are trying autonomous cars and so on, where there is a lot of demand for AI computation. Okay, so so all this learning, okay, in general I like to call as machine learning. Okay, so these are essentially what you can say are different types of regression models that we do in our engineering. Okay, so for different data. So anyway, so that's important for the healthcare system. Another component I see that has a lot of potential is brain-computer interface, and you can do brain-computer interface using various technologies. Okay, EEG or MRI based and so on. Okay, and it has a lot of potential. Specifically, potential to take care of let's say paralytic patient who cannot manage a lot of things. So as a result, the thought process needs to be translated to certain actions. In the left side diagram, what is shown is the thought process is translated to movement of a wheelchair. In the right side, thought process is translated to changing of TV channels. Another component of healthcare that I see has a lot of potential is virtual reality. Okay, virtual reality in the left side we have, which can help in the surgery. Okay, and virtual reality can help in therapy, particularly what a lot of potential it has is to address what is called post-traumatic stress disorder. That is a serious stress condition. Stress and anxiety and other things can be handled, and virtual reality can play a major role in smart healthcare system. Data is very important. Okay, and unless we have good data, we cannot make decisions. Okay, so health science is seriously data driven. Okay, then people need to participate. Okay, in the data. That means somebody sharing certain information that goes to a bigger data set of the state, of the city, of the state, and so on, and as a result, doctor can make certain decisions. Some examples I share with you that my students have done in last several years. Okay, a lot of work we did on stress. Stress we saw is a serious problem. Okay, particularly like 75% in US have some level of stress, and 6 to 10 workers experience workplace stress in general in all countries together. So this needs to be addressed. Okay, and stress comes from various sources, particularly distress, which is a negative stress, is a very important thing that one needs to address. Okay, and that results to various consequences in the long run: lack of energy, lack of enthusiasm, then diabetes and so on can indirectly result as a result of that. So this needs to be addressed, and some of my students have been doing a lot of work on this. And what we want to do in the long run, and we have now, this slide is now around 4 or 5 years old, and we have this vision, we had rather this vision, that is we should be able to monitor stress from various physical parameters as well as food habits, sleeping parameters, and so on. And then we should be able to classify the level of stress from there. And what is important is automatically, okay, a person who is stressed will not cooperate necessarily with the more serious healthcare mechanisms. So I have to have a autonomous system that monitors the stress and then advises the user what to do next. That's the big picture. Okay, so and we have solved a lot of things, and I'll be showing you some of the results. Okay, so this is unique in automatically what you can say, analyzing and quantifying the stress and then giving advice to do something. Okay, for example, starting with do yoga, breathing exercise, and so on. So various what you can say consumer devices are actually available that has the potential to give us a certain level of information, okay, about what you can say, what data we need to decide something somebody stressed or not. Okay, we can use, but it's not straightforward. Okay, that's a lot of research needed. Okay, to get based on that data to decide what is that stress condition and so on. So past work we did is based on like sensor data, okay, how to detect stress and automatically and accurately. So we developed the first method, what we call as stress lysis, where we are able to automatically detect stress from different physical parameters, particularly the sweat of somebody. Okay, and then able to say what is the level of stress he or she has, high level, low level, and so on. So we have developed, so obviously there was a machine learning model that was running, and we verified that whole thing in this one was whole thing was validated based on some data from Kaggle, and also in open, so complete open framework in MATLAB with ThinkScape and so on as the cloud. And the results were around, as far as I remember, like in the 90% range, the what you can say, the accuracy of what is the stress level and so on. Okay. Anyway, so then another work we did, what we call as smart pillow, where based on the sleeping parameters, we decide the stress level, and then we predict in the next day what will be the situation of the person in terms of stress and how he or she can take care of something. So different consumer electronic devices available in market have certain capabilities to do such, okay, but they have a lot of limitations, and we try to address those limitations so that we have a far better device to do those sleep tracking along with the stress monitoring and so on. So starting from Fitbit has certain reasonable capabilities, then DIM, use, all these have certain things, but still they're not accurate enough, and a lot more features are missing. So we developed this what we call a smart pillow, which is electronics that basically stays in a pillow on the cover of the pillow. Okay, and then it takes care of heart rate, snoring, respiration rate, all these things, data from the user, and then tracks it with different models running, okay, and then characterizes to low, medium, low, then medium, and so on, 5 different stress levels, and then then one can use this to essentially predict next day's stress condition, or current night condition can be monitored, and then daytime certain advice can be given. So it has different potentials, and we have been working on this and further developing this system. So what is the big picture that we have already done in another work, what we call as SIO pillow, that is smart yoga pillow. And this pillow is monitoring, okay, the sleeping pattern completely, a complete cycle, okay, of the sleeping. That is somebody trying to sleep but hasn't slept, and then different other conditions in non-rapid eye movement, rapid eye movement, all this is monitoring, and then able to suggest what are the stress level and so on, so that the user can take care of himself or herself. So we, in this particular smart pillow, which is being now developed as a pillow, okay, we have snoring range, respiration rate, heart rate, and so on. All these parameters are considered and to classify the stress to different levels. Another work we have done, what we call as IPLs, okay, which is a interesting work, and that is going to be presented soon in the IEEE Smart Cities Conference, where what we are doing is we are developing methods that user can use as stress control mechanism. So we have now various mechanisms from physiological parameters, from food habit, and so on, to monitor stress. And with that, what we can do is we can then decide after stress level is known, okay, what kind of therapy one can have. So for example, that is whether somebody needs to do physical exercise, yoga, and so on, or somebody needs to have different type of meals, that is what to eat, so that your stress level goes down, or even play music or display stress relief paintings and so on, so that one can have a cure of the stress and so on. All these things can be done. Stress control approach we can classify those to live approach, that means something happened, short-term remedy, okay, and long-term approach like weekly approach and monthly approach can be put together in the whole system, so that along with stress level monitoring, somebody is getting information how to control stress. So we developed the whole system, okay, including the mobile app shown we have developed. This is a illustration of whatever we have done. And this is running fully automated, and user can get in the phone app, okay, what are the stress level and what advices possibly can have to control the stress. Another work one student did, and also a student continued. So essentially 2 students worked on this area, what is food intake monitoring automatically, obviously, and diet management, okay. And this is important because food is everything, okay. If you have bad food, we have bad health conditions. So important is the automatic, okay. Imbalanced diet has its own situations, and globally what is observed that 11 million deaths and 225 million what they call as a DALYs, that disability adjusted life years, are attributed to dietary risk factors, okay. Diet can have problems like psychological disorder, obesity, malnutrition. In India, it's also another problem. Then diabetes and so on can happen. So imbalanced diet is everything. So the key idea here, what we did is how to do an automated approach so that the diet can be managed. And then obviously we were analyzing what is available right now in the market. Okay, a lot of things are available, but none of them, none of these, what you can say, complete in giving automated solutions for us. And then also another important is predicting what diets should one should have. So that is what our objective. that is fully automatic, and then prediction. So in the current literature, what methods available for fully automatic can be classified rather to three different things. That is hand and mouth movement. Based on that, we can decide basically what somebody ate. Okay, that means, for example, a food that makes more noise can is a specific type of food, or food when somebody eats it doesn't make noise. Okay, is one type of food. Like that, automatic method can be developed. And food weight sensing and so on. Okay, and food image processing is another, which are computer vision approaches. Okay, those things can be done. So we have developed primarily the last two. Okay, and food image processing is what I like more. It has more potential to be what you can say automated. So iLog is one system we developed, fully automated detection system with 98% accuracy. What is that it's doing? That is one app essentially that let's say we have a wearable with that is like a glass with a camera, or a camera can be mounted on a wall and so on. Okay, and that camera with a different computer vision basically methods, which are machine learning based, of course, and then detecting automatically the different types of food, and then automatically quantifying the calorie of those food, okay, when somebody consumed. So computer vision based method, and we developed a very big database of different agricultural items and so on, and their calorie values. For example, let us say rice, okay, what is the calorie intake possible, and then bread, like that. A big database we made based on different items from data.gov, and then automatically, like when somebody eats, the camera takes picture, and then in your phone you have all the information, how much is the calorie intake, and you can potentially know even what is your stress level based on the food data, and also what you should eat as the next meal. All this can be done. So diet prediction we are doing, and this is a method we developed for diet prediction. And that is what is the intake that happened, that iLog work did for us, automatic intake quantification. Okay, and then SmartLog work we did that essentially suggests what should be the next diet based on what somebody ate right now. So, so this is a foolproof solution for the automatic for calorie quantification and diet prediction. Smart healthcare, so that prediction is happening with the help of a deep neural network model, and this is a 5-layer model that we developed where different meals are analyzed, and then like in a semi-automated approach, weights of different meals can be taken, or a fully automated computer vision approach, the pictures are being analyzed and quantified. And then this is the intended nutrition goal we have. Based on that, we can basically declare or predict, okay, what can be the diet in next diet, so that somebody maintains good health. Another work we did, a couple of PhDs have graduated on this, that is the epileptic seizure detection. And I saw from a flyer that is easy data set analysis was one of the intentions that this faculty development program has. So we did seizure detection based on EEG, okay, and 2 students graduated. One last year, one student graduated, he joined New Mexico as a faculty, and another student graduated, he joined IBM. So we'll be discussing some of those. And again, seizure is a very important problem, okay, because of 1% of population suffer from it, and it is considered as the 4th most common neurological disorder after migraine, stroke, and Alzheimer's. So a lot of scope to do, and people have been doing. Okay, so seizure can be detected from the EEG and non-EEG possibilities, and the EEG data can be analyzed in time domain, frequency domain, wavelet domain. So all these domains is possible. Okay, and we have done mostly in wavelet domain, but time domain and frequency domain are possible. So what is available in the market is this. This is a seizure watch that can basically Empatica is doing, that is, it can monitor when seizure is happening. Okay, but this is definitely not ease-based. The reason being, it's not connected to the brain, and it tracks muscle movement and so on. Okay, to decide when somebody is getting seizure. This is an important problem. So industries are also trying. Okay, IBM has the specialized chip called True North, which is being used specifically for the AI modeling and so on. Okay, and they trained around a decade of data, 10 years of each data to have models that can accurately detect seizure. Okay, and we were motivated to solve this problem, and we have solved to a certain extent. Okay, for example, like what we see that the seizure detection, the current work take more time. Okay, and cannot be done in a real-time environment situation, and there is no control mechanism after seizure happens. So what we did, our challenge is to develop this, and as I said, 2 of my PhD students work on this problem. And what is this problem? That is, we want to detect seizure in less than 1 second. The bottom figure that shows you, I'm in slide number 69. That is in the current situation is green A, okay, where typical latency is in the range of 4 seconds. Okay, and our target has been to develop methods that will detect seizure in less than 1 or 2 seconds in that time frame. Okay, and the capital C red color is a big challenge. That is, how do you declare seizure may happen? That means how to predict that seizure will happen in future. That's a most difficult problem, and there are different uncertainty in terms of what medical conditions come together can suggest, okay, somebody is going to get seizure, which is a difficult problem, but at least we have solved from detection point of view in around 1 second time frame to declare somebody got seizure, and then potentially inject drugs to control that. So one student did this, what we call neurodetect, that is a deep learning model that is detecting seizure in a reasonable time. And what is interesting is to we also verified if we do a cloud computing environment versus edge computing, that is IoT edge versus IoT cloud, okay, how the seizure detection mechanism affects getting affected. That means where the machine learning models of seizure is running. Okay, that is the key. Okay, and we found with our edge computing paradigm, targeted machine learning model is able to detect seizure in around 1 second, 1.4 specifically. Okay, and a little bit complicated model for the same reason can run in the cloud and is taking more time. And then imagine it's not just the latency, also the communication latency, then communication failure that it can potentially have. Those are obviously big parameters that will come when we have IoT cloud instead of IoT edge. So we did this in the wavelet domain. So this is the wavelet, and then there are this machine learning model, deep learning model in this specific scenario is running and giving seizure in the range of 1 or 2 seconds. And then another student, those work one student did, and a lot more he had done. I have just selective slides for you. And another work, last student who graduated and joined IBM, he did is how to model seizure more accurately, taking into account the spatial correlations, because seizure can originate from various different locations of the brain. So based on data collected, how we can model it so that we can more accurately predict or rather detect and in future maybe predict, okay, the seizure based on the EEG. So we what you can say used a method called kriging. Kriging is a geospatial method which has been used long time ago, and we are the first one to bring it to health science area. Okay, and in fact around 10 years ago we were the first one to bring kriging to nanoelectronic design, and we had a lot of interesting results, and we had that experience, and last year we decided to explore in the healthcare paradigm, and that gives us some great result that you will see. So the big picture of kriging-based seizure detection is like this. So we are doing wavelet transformation, then we are feature extraction, and in the fractal dimension we're doing, and then we are using kriging as classifier in this specific case. And compared to the existing literature, what it shows that this method is able to give a seizure in less than 1 second, 0.85 second. Okay, that's a significant result. We are able to say somebody got a seizure in less than 1 second. Then, so a lot more details are there, which in the interest of time I'm skipping. But you can see my website. All my publications are in public domain. Preprints are available. Okay, and so we have seizure. Okay, then we need to have some control mechanism. So this is the big picture of what are the control mechanisms available. Okay, one can take medicine, one can go for surgery for serious problems. Okay, and different therapy like deep brain stimulus, neurostimulation, all these can be done. Like for example, the brain pacemaker kind of mechanism. And then direct drug injection is where we are giving direct basically drugs in the location that originated seizure, and so that means it's a blend in the brain. There are drug delivery mechanism that will inject drugs. So this is a big picture of an implantable that can potentially release drugs, okay, in the brain, okay, and it obviously has to have a unit that detects and communicates with the external thing. So that can be implanted somewhere in the chest, okay, like a pacemaker, but this is a different purpose and maybe in a little bit different location than a regular pacemaker. And then through a catheter, it is communicating with certain location of the brain to do back and forth communication with the brain and doing seizure detection and control. That's the big idea. So we designed a full-blown system, okay, and that to do all those that I just discussed, that is to detect seizure and then to inject drugs automatically when needed. Okay, and in fact, in addition to that, we are trying to also develop along with that mechanism where that doctor can also control the doses, that is what milliliter of doses needs to be given at what time and so on. Can be done. So we developed for different, this is electromagnetic based pump, and this is piezoelectric activated pumps, and we experimented with the dual reservoir and so on. Okay, so that let us say one reservoir with certain liquid fails and another reservoir can work. That is the one of the motivation, and we did all those. Then another work one student is has started doing, okay, that is fall detection. Okay, old people have a lot of chances of getting fall, and what statistics shows, around 1/3 of elderly population get above 65. That means they have some fall problem every year. Okay, and there are a lot of, as a result, hospitalization and so on. So we thought of solving this problem. So there are certain capabilities consumer electronics have to do that fall detection, okay, but they have serious limitations as I have outlined here, okay, and we are trying to do something better than that. That is to potentially predict fall, okay, not just to detect. Detect means we are detecting after it happens, but our goal is to predict when fall, before fall happens. So we developed what is called good eye, okay, and then good eye based on certain physiological data as well as visual data. It predicts when fall, before fall happens or after fall happens, right away, that is fall happened. So we call this good eye, and it's taking different physiological sensor unit and image data and so on, and with machine learning models, it is predicting. So it's a form of wearable, one can say, or if a person living at home and needs fall detection, also the cameras can be mounted on the wall, and then that camera does connecting through router kind of mechanism to the processing. So with this visual thing we did, that is based on the visual data, that means from the images, how we can declare somebody fell. So this here frame 1, frame 2, if you compare, somebody fell down. So those x1, y1 and x2, y2 coordinates we compare and declare something, whether fall or not. And then also in the color coordinate, okay, this situation RGB and RGB, how these parameters are computed. And then with the distance formula, we decide, okay, somebody fell or somebody did not fall. Okay, so anyway, so that's why, and with automatic mechanism we can declare. So we did this validation of good eye, okay, that is able to do this fault detection with a 95% accuracy. Then another serious health problem that I am more excited to work on, and have been working with certain collaborators internationally, okay, that is diabetes. It's a global crisis, and India in particular has a serious problem. So if you see, that is in 2020 itself, we have around 500 million population with seizure, okay. Sorry, with diabetes conditions. So these are millions, so in the hundreds of millions. So this is close to 500 million, I can say. So with diabetes, and this is a pandemic rather, I would say a lot more people are affected. There is a lot more. We have some solutions, but the solutions are expensive, and the solutions also needs continuous involvement of the patient who wants the care, and we want to do something better. So what is our long-term goal? That is in the right side, as you can see, the long-term goal is to come up with a mechanism which doesn't need blood samples all the time. No fingerprinting, pricking, please. That is what my motto here. So in the current situation, we have invasive approach mostly, whether we are using capillary glucose or serum glucose. So these are being done. Okay, but blood sample is involved in those. Okay, but we want to have mechanism which is not taking blood sample. It's an optical signal that goes to the human body and then tells what is the glucose level and so on. So that's what we want to achieve. And others are also trying. PPG based things are available as well, but we are trying to come up with rather we have now already come up with a different spectroscopy with near infrared signal that goes inside the human body and then quantifies what the glucose level and so on. So we have developed that spectroscopy and we have the device ready. And in the long term, what we want to do is we want to monitor this automatically, and at the same time, with automatic monitoring, how do we come up with an overall smart healthcare framework and then decide what kind of insulin needs to be pumped into a human body, okay, so that his or her diabetic condition is always under control. So we have called this device as iGlue, okay, and you can see my website, a lot of publications in this problem, and we have a foolproof solution. And the spectroscopy we have developed, this is an illustration of that. That is two different basically LEDs and then the photo detector and so on, they're working. So this is a dual wavelength spectroscopy, and then that spectroscopy is accurately detecting, okay, what is the glucose level, okay, and this is a very low cost device. Our initial prototyping suggests it's in the range of $20, okay, in the development phase, that is buying of the cell component, okay, but when it will be a real device, that cost may be a little bit more, but what is currently available in the market in US, very few products are available to do this, and the one that is available with prescription in US actually, that's more than $1,000 in price. So anyway, and so what is important for this iGlue is here I was mentioning iGlue 1, which is a device that is doing, we have calibrated with capillary glucose and doing very good detection. In addition, we have also calibrated with serum glucose, okay, which is much more accurate than doctors tell, okay, and Then as a result, we have like a really medically accurate wearable, which is amazing and can have serious social impacts. As you can see, if you go, we have in the range of 500 million people are now having diabetes conditions. So there are certain challenges on the smart healthcare, and a lot of challenges being solved, and the people are working. Okay, for example, the human beings are part of the internet as a result. Okay, that is, if somebody has an implantable, somebody has a wearable, and that's connected to the internet, essentially you're part of the internet. Okay, so this is the big picture of what is evolving, and what is called internet of medical things is not the, that is the subset of that. Rather, internet of everything is what is a big thing that is coming, which will have process data. People think everything basically as a bigger. So that means human beings are a participatory and serious participatory in the overall system, and rather integral part of it. So internet of everything is eventually going to take over everything as a bigger umbrella. So anyway, so smart healthcare has low power requirements, speed requirements, security, privacy, all these different requirements, which are challenges that engineers and scientists need to solve. So primary thing is the quality of data is important. That is how to make different models to predict about health condition, to predict about epidemiology. Okay, data is key. Suppose we have wrong data, okay, we'll have wrong predictions. Okay, we'll make wrong health decisions. So data quality is very important. Okay, that is coming from reliable source, and nobody has manipulated it, and then it has all the data. Let us say we want to monitor a heart condition for several days. We need to have those data for completely for those several days, and so on. Okay, and so various situations that is important to consider data as acquired data. So that's key for smart healthcare. And data needs to be modeled. Okay, and data modeling has its own set of challenges because of need of the resource and underfitting, overfitting, and so on. All these things needs to be handled. Okay, in the machine learning situation. And the model needs to be a good model so that it can run. It's like we know modeling of the data needs energy. At the same time, model to run in the hardware also needs the hardware resource. So we have to have a right type of model that can be trained and that can be executed. So security challenges are multifold. Lot of security challenges like data eavesdropping, that is unauthorized selling, basically getting somebody's data. And then privacy, that essentially deals with that is, you do not want certain people to have access to your data. You want to that data to be made private to them, and as a result, that's a major issue. And how we can have access control in the healthcare system, that is only let's say you want to have NORS a certain level of access, PCP certain level of access, insurance company certain level of access. How you ensure those? And information privacy is very important in the healthcare. Okay, that is, who wants to have access, who should not have those decisions we take. And what is observed, that is privacy violation is a serious problem. Okay, and without authorization of patient, getting data access is a problem. Data stolen physically is a major problem. 55% of time that happens, and data is lost, and all these things are also problems. And in addition to data, what I'm an advocate of is security of the devices. Okay, for example, a wearable is connected, implantable is connected. So as a result of that, that is device are compromised. So device can be hacked. So how do you take that into account? That can have serious consequences. Okay, for example, somebody hacking the pacemaker, somebody is hacking the insulin pump. Those can have serious health consequences. So somebody can drain the battery. Okay, battery of a of a pacemaker needs to last 10 years. Okay, so if that happens much sooner, so there is scary situations. And in addition, smart healthcare challenges are ethics aspects. Okay, that is how to ensure that is these smart healthcare features are added to somebody, but at the same time, privacy is not affected. Then it's not too much bothering day-to-day life of somebody. Then who owns the data when data is collected, those are clearly specified. All these are different ethical aspects. Safety aspects are also important for healthcare conditions. That is, if a wearable and wearable doesn't go well with the body, there is a problem. Okay, so a lot of that's why safety aspects are there and they need to be addressed. So some challenges we have solutions, but in a big picture, what I tell that is any rather I would say any smart system, okay, there's healthcare or other things, okay, needs to have these things. But in the healthcare, which is much more personal, one-to-one, okay, ethics, safety are important along with what we typically consider as energy consumption point of view, security, privacy, and intelligence. That is the getting information out of the data that we have. So all these are multi-objective and need to be addressed. And in IOMT, Internal Medical Things Framework, or we say Healthcare Cyber Physical System Framework, this trade-off has to be, these are the different trade-offs that one needs to handle. And depending on where we are computing, that means where we are our machine learning models, okay, that are being developed and executed. So we can explore in sensor computing, okay, at edge computing, and in IoT cloud computing. These are different alternatives available. Okay, and we keeping these in mind that we have to have better models, accurate, which are at the same time lightweight. Okay, we explored some mechanisms. Okay, what we call one thing is hierarchical machine learning model, how we can develop that will execute things much faster at the same time with minimal resource. So we have what we started with, what we call bootstrap kriging, where we take initial small sample and we generate bigger sample based on the need by executing formula or model of the kriging instead of continuously doing the modeling. So smaller size actual data, bigger data can be generated or synthesized from the kriging model. That is one example tried. And with this mechanism, we had developed deep neural network 4-layer model with data fed from the kriging model instead of the actual data. And this is doing amazing. The model is accurate and the model is trained much faster. At the same time, doing the execution much better. So that is here. It's a DNA and this kriging DNA. The accuracy is very good and the training is much faster, as you can see. And then so hierarchical ML is doing a good job. So in addition to that, we tried another thing, what we call distributed modeling, or distributed, that means kriging model, running partial data and developing the model, and then those partial data, what we can call as a quasi output, that is again further processed to develop the overall bigger model. So this idea we tried, okay, which we call distributed kriging bootstrap DNA model, where we have different core is running on different portion of the data, and then doing the modeling, and those models are further aggregated, and then we have a more kriging model as a result, which has potential to run much faster and at the same time accurate. Okay, and then we train a DNA model with that, and as a result we have basically overall model which is running much faster and is accurate as well. So like we can see here, we're able to train in a few seconds time the data that we have, and training time reduced significantly. Okay, ordinary kriging DNA, this is like a hierarchical kriging, then this is distributed hierarchical kriging. Okay, its running time has significantly reduced. So you run with different running time real life data sets, and we have proven that this is running giving us seizure in less than 1 second time. Then security point, we have done a lot more work. Okay, I may discuss in a separate what you can say talk more details about security. And this is just a glimpse of that. That is how we developed POP-based security. POP is physical uncountable function for smart healthcare system, so that particularly the implantable and wearable medical devices have foolproof security. and we have done some amazing result. And in addition, data, as I said, is the key. Okay, a lot of results in the healthcare system are data driven. So blockchain can be used for this purpose, and then blockchain not only preserves data, also can play a role in integrating methods that can do privacy and so on. So blockchain based, that is compared to a traditional information in the health, okay, blockchain has different opportunities that it can provide. Okay, and we have been working on that. So in the smart yoga pillow idea that we have, we experimented that approach, that is how to have different blockchains, and the idea here is let us say 1 million users are there. Okay, then we'll have 1 million blockchains. That means everybody will have one blockchain, and then that blockchain stays in a centralized server. Okay, and then that means IoT cloud, and then everybody's data is in the blockchain, preserved and being accessible to healthcare provider and so on. So we developed the complete picture. We have a full validation of this idea with a smart contract and so on. There's a public domain framework of the blockchain smart contract. And that's amazing results that we have noticed. That is a foolproof medical solution here, what we call a smart yoga pillow, that is monitoring stress and storing all the information in blockchain in like a secured fashion. And for millions of people, millions of blockchains are, we have validated with hundreds of people in this experimental platform, but it can have a lot of people in the system as well. So with this, we have the conclusions. What we learned here: smart healthcare system, different characteristics, different components, different examples, what are the challenges, and how those challenges can be potentially solved. Okay, and what we have done so far in that direction. All these things we discussed. And there are ample opportunities, and healthcare is certain thing. I always tell that is a healthcare system is more country specific, rather I would say. Even if you have these electronic, the principles are in general applicable, but different countries may have different demand of what is their health problem and what they need to do to address those health problems. And for example, India, diabetes can be a problem. US, for example, obesity can be a problem, like that, depending on what country has what health problem. Of course, currently, pandemic is a serious problem for everybody, and smart healthcare has potential. And if you go to my website, I have certain articles, okay, how in current pandemic situation, how diabetes and so on can be controlled with the help of our iGlue mechanism or iLog mechanism. So that concludes my talk on the smart healthcare. I hope all of you have learned certain aspect of it, and please feel free to ask me questions, and I'll be happy to answer what questions you may have.
Good evening, sir.
Good evening.
Sir, my question is, if like blockchain, there is a scalability issue, is there? So is
Yeah.
it, so how we can store the data like completely over blockchain, or is there any other mechanism we can use to store the data optimally?
Okay, excellent. So that question is perfectly a timely question. Okay, and actually we have solved that problem. Okay, we have so the scalability comes because of the consensus mechanism that blockchain has, and that is one type of scalability problem comes. And another type of scalability problem comes because we are doing traditionally that all the data being stored in the blockchain. Okay, so I call that as on-chain storage. Okay, and scalability problem or consensus algorithm like proof of work, all this come to picture because proof of work like mechanisms they take a lot of energy, okay, to do the consensus. So we have solved that problem. We have an algorithm. If you go to my website, we call it proof of authentication. Okay, so proof of authentication is an algorithm that runs with very minimal energy. It can run even a Raspberry kind of mechanism where we are taken out the consensus mechanism like proof of work and replaced with something simpler with the cryptographic based. And another thing is what is called on-chain storage. It's not a feasible situation, even though initially when blockchain came, the intention was not to store that kind of data that we are thinking in smart healthcare and so on. For example, if you have data of the whole country, okay, billion population, or even the whole data of the whole state, which is millions of population, you cannot store in the blockchain, particularly if everybody in the regular public blockchain, everybody has the data. That means every computer has to have data of millions of people, which is not practical possible. So off-chain storage, where data is outside the blockchain, and the blockchain is essentially used as a management mechanism of those data. Okay, that is a off-chain storage is another solution. So your question was scalability, and the scalability two ways, that is how to simplify the consensus algorithm and how to store outside the blockchain, not on the blockchain, rather off-chain storage is a solution as well.
Thank you, sir.
Sure.
Sir, I have a question.
Sure.
In India-like country, how far it is possible to adopt such type of smart healthcare system?
It's definitely so. If it's rather, I would answer a different way, that India needs it. Okay, it's not other way how far India can do. Okay, actually, if you see the cost point of view and so on, okay, initial establishment cost is high. If you are talking about the electronic health record, which potentially can stay in a centralized fashion. Okay, that is either a state government or federal government, or central government, or different entities, they have to have that healthcare record. That is a big investment. Okay, that I agree. But like personalized healthcare, that with having wearables, with implantable, that we take care of our own health, that doesn't cost that much. For example, I myself always experiment. Like my heartbeat, my 1 EKG I take, there is it's a 1 EKG device, it costs around $100. Okay, and then this heart rate, then all these things is cheaper. It's not that expensive. Then one-to-one personalized healthcare, and then with my data, I talk to the doctor. That is my Fitbit is showing me this, my EKG device is showing me that. So how I take care? That is what I do in day-to-day life. Okay, and that is not that expensive. Okay, with around, let's say, around 30,000 rupees, if you spend Indian rupees, you have those devices with you, and then you take care of your health reasonably. So that means what I see, I know a lot of people who have diabetes problem in India, and they always have a problem after the health condition happens. They go to doctor after, right? But I go to doctor before the health condition happens. Okay, that's the difference. And the proactive, okay, that is a preventive, and then personalize those aspects of healthcare one-to-one, doesn't need the big what you can say centralized healthcare record, which obviously, as I said, when you want to deal with the whole state or the whole country, that's a far bigger investment, and it will take time. India Prime Minister started announcing that is in the 15th August, that is they will do the digital or electronic health. That will take 10 years. And I remember 2-3 announcements. One is the agriculture based, that is again 10 years effort. Healthcare will take 10 years. And similarly, another announcement I heard, that is the fiber optics. Fiber optics, India has reasonable, but they haven't taken full advantage of it. Fiber optics, there are many places, in many villages, in fact. Okay, but how to effectively use it for healthcare, that needs some discussion and some what you can say solutions. But they're not, as I said, unless you want centralized and other things, which that is expensive. But rest all personalized healthcare are doable with very minimal expenditure.
And sir, one more thing, what would be the real challenges while capturing the real-time data from the wearable devices fitted on the body?
So challenge is to store and analyze. Okay, and so that means if you have wearable, let us say continuously it's taking EKG and so on. Okay, where you store it and how do you analyze from that EKG what is the condition? For example, you have slow heart or fast heart or normal or what is your resting heart condition, all these things. So these are challenges, and there are some software. So what I myself personally do, I do maintain a spreadsheet of my own data. Okay, that means in an XLS file, I do record of everything once in a week. So then I know like what problems I may have or I had, and then I go on to talk to her that I have this health condition, then I want to address. So that's a smart. Definitely, I have practical my own personal experience. So how smart healthcare devices are helping to take care of my health record. What I said is proactively. Before it happens, you go to the doctor because you have data. That's the key. And those challenges meaning there are challenges available, but you solve. But as I said, automatic and other things. Okay, there are a lot of scope to solve the problem. Okay, but that is other research. Okay, we have been working. A lot of other people in US as well as in India. I've been doing a lot of collaboration. For example, with NIT Jaipur. Okay, MNIT Jaipur, and also with Triple IT Noida Raipur, I started on smart agriculture related stuff and smart healthcare with MNIT Jaipur. Okay, all these things. So like people are working. Okay, I think eventually further better solutions will be available. But as of now, it's working with a reasonable expenditure with your manual involvement. Okay, but as I said, automatic still needs some more research. But with a reasonable manual, we are able to work.
Yes, sir. Yes, sir. Thank you, sir.
Thank
Sir,
you.
one more question from the participant.
Okay.
Yeah, he has asked, sir, as per the decentralization concept of blockchain, for every transaction, one random authority has to be chosen by solving nonce problem. Is it feasible in healthcare system?
Okay, excellent question. So we have solved, and you go through my slides, you will see in the bottom of all my slides, I have source which are potentially mostly my publications. Okay, and we have solved this problem in the smart healthcare system. What we advocate, that is when you are using in the smart healthcare, don't go for public blockchain, have private blockchain. Okay, and that means centralized, for example, either a state government authority or a central government authority, in US case, federal government authority, they are the ones who are essentially managing the blockchain. It's a what I said is the private blockchain and centralized for certain purposes and decentralized for certain purposes. That means every hospital, every patient may have a decentralized fashion, but at the end, a central authority is controlling that blockchain. Okay, that private blockchain. So that is the solution. Okay, with full public, you don't need full public in the smart healthcare system. In fact, what I tell, it's like blockchain has so much potential, but blockchain overhead is too much because the fundamental assumption is public blockchain where you cannot trust any participating node. That is the assumption. That assumption and what you can say assumption is what makes blockchain expensive. But if you make private and centralized authority to decide which nodes are participating, which nodes cannot participate, you solve the trust problem significantly. Okay, and blockchain as a result will work much more effectively in the blockchain if you follow this approach than the original approach of what blockchain came for the cryptocurrency like Bitcoin.
Sir, in private blockchain, is it really necessary to use the hash?
It has yes, because we may work with a lightweight instead of going for whatever robust mechanism for hash. You may go for lightweight hash mechanism, but what we have seen it is needed. Okay, we have in fact we have restructured a different block header and so on. That is, if you go to my website, we have different what you can say block structures. Okay, and we have. In fact, come up with what we call multi-chain block approach, multi-chain blockchain approach, and so on. which are solving those problems. Okay, so we have variety of this year, one student, he developed a multi-chain approach, and also we have a off-chain storage approach, and that is then block structure as a result is completely changed. But we have seen some level of hash is there needed because of like even among our group. Okay, we do not want, are we sharing for example, in a simplistic sense, all the information with our own colleagues, even if we are in part of network or in a family, we have different things. So hash as a result is needed, okay, for its functionality, but it can be less what you can say overhead compared to a public blockchain.
Good evening, sir.
Sure.
Hello. Good evening,
Yes.
sir. Sir, actually, already you told that just after a few years, like our diabetic systems will be totally with the pandemic. So, in that particular situation, you see that insulin pumps already it is available, but it is not popularized till now. And like your what you told in the papers are due to this iGlow. So actually, when it will be more popularized and people will avoid this type of injective works, and they would every time they are suffering this type of things. So how when it will be actually popularized, and they will actually this is the problem. But till now we are suffering, all we are suffering.
Right.
When it's solved, sir?
Right. So this is actually these are multiple scenarios. One is a medical point of view, solving that problem. Okay, so that people have confidence that that works. That is the first thing. Okay, when we are using these wearables, implantable, smart healthcare system in general, okay, trust of the user is important factor. Okay, that is like a lot of people don't like those actually. Okay, for example, I like I'm a tech savvy, so I like using these wearables. But a lot of people don't like the wearable actually. Okay, so trust factor of the user is important. First, in the healthcare point of view, that problems need to be solved much more reliably. That is one. And second, people need to trust that these things can help me. Okay, that is one. And then affordable. Okay, for example, in US, what is available right now is $1,500. That comes with a prescription, not without prescription. We go buy a phone, we go buy a Fitbit from the market, but to buy even whatever available in US, okay, you need doctor's prescription, and it's expensive in the range of $1,200, $1,500. Okay, so all these obstacles needs to change. Okay, and then only, and it's a chicken egg problem. Once people start using more and more, the price will come down. Okay, and definitely this iGlue we have developed, we have filed a patent in India instead of filing in US. Okay, because most of the work I've been helping. Okay, but NIT Jaipur did, so I told, okay, why don't we first file patent in India instead of US? So we have filed a patent. So then after that comes the commercialization. That is like we need to mass produce. Okay, let's say we right now for experiment purposes we produce 10 or 20 of them, but we need to produce let's say 1,000 of them, and then do what is called clinical trial. Maybe in India ICMR or who does the clinical trial, we have to go through them, then only it will be available in the market. Okay, so it's not the what you can say, I visualize that it can be done in a year or so time. Okay, and once it becomes cheaper and reliable, that means without doctor prescription it can be given, then it will become popular.
Thank you, sir. Thank you.
Good evening, sir. Sir,
Yes.
as you discussed with us, such the pillow, sir, you discussed, sir, smart pillow. So you had also shown us the parameters using which you would be taking up the data. So
Sure.
I just want a bit clarification on that. So you had taken for snoring and the stress. So I couldn't correlate between the snoring and the stress. So how can they both
Right.
be
So we
taken
have very good. So we, based on the medical literature, okay, we like say snoring, what is the decibel? Okay, so that means the noise it comes, what decibel range, and to correlate that to what kind of stress level. So we get this information from the medical literature, and you can see details for those in the paper or send me a question, email. Okay, so in the in a smart pillow paper, and which we then eventually went to a bigger entity called Sayo pillow, smart yoga pillow we call. Okay, so there we have discussed complete details of snoring rate, and then also what you can say, heart rate, all these things. Okay, and so the different numbers. Okay, what range of heart rate, that is beats per minute, and then snoring rate in decibel. So all these we have different range, and then based on the medical literature, we combine them. That is what translates to high, what translates to low, what translates to medium, and so on. Okay, so if you need specific numbers, I can definitely connect to you, meaning I can share the paper and discuss with you, or I can connect to the student who is doing. Okay, she is going to defend her PhD.
So the range decides whether the stress is high or the stress is low. So that is what I like. I wanted a clarification.
Yes, and so yeah, so different range coming from the medical literature, because we are not doctors, we are engineers. Okay,
Yes, sir. Yes, sir.
so those based on there, we do that. What and snoring specifically is decibel. Okay, it's a noise. Okay, we monitor.
Yes, sir.
Okay, thank you.
Okay, sir. Thank you, sir.
Sure. Okay, somebody has a question. Amrutansu Panic, right? The storage procedure is quite complex in blockchain. Healthcare is generate data dynamically. Then how to reduce time complexity more acceptable? Okay, yes, we have solution. Okay, and in the what you can say, we have developed a different type of blockchain. Okay, that is what I call as a proof of authentication based blockchain, POAH. We use the term. So where we have blockchain that doesn't need the heavy duty proof of work kind of consensus. Okay, that is one. And second, it we are along with that, we are adding storage mechanism outside the chain. Off chain, we call it off chain storage. On chain storage cannot be scalable, because I simply ask, let's say a whole country of data you want to store in the blockchain, 1 billion, and in a traditional blockchain which is fully decentralized, okay, every blockchain stores that information. So it's like every computer has to have several terabytes of data. That's not possible. So that's off-chain storage stays somewhere outside the blockchain, and blockchain essentially is a manager of that data. That is what is the vision. And we have developed some solutions, and we are also further working on another blockchain which will foolproof. That is with distributed file server like IFPS and so on. Okay, that is kind of like storage mechanism, and then working along with the blockchain. Okay, that is interplanetary file system. Okay, IPFS. Okay, kind of file system storing the health record data outside. Okay, and then doing for all these things for us. So that is what we are trying to develop. Okay, any other questions?
So I don't find any other questions as of.
Sure. Okay, very good. Yeah.
Thank
So
you,
feel
sir.
free
Sir,
to,
it
if you
was-
have further questions, please feel free to email me. It's not a big deal. Okay, and I'll be happy to reply your questions. Okay.
Thank you, sir. Sir, the session was really very much informative and very elaborative. All the participants present in the session would have been really, the information shared would have been really very helpful for them. It was
Sure.
great hearing you, sir.
Okay, thank you. And you can go to my website. Okay, all these are in public domain. Okay, and feel free to let me know if you have any other questions. Okay, thank you. Thank you very much.
Thank you, sir.